Well, welcome. I am so excited to have all of you joining us today for, I think, what is a very impactful and interesting webinar that Strategic Marketplace Initiative and the Strategic National Stockpile team have put together. I have several friends to introduce you to today. The first one is Lisa Holman from Concordance. Concordance Healthcare was actively involved in much of the activity with FEMA early on in the process of the pandemic. She has a firsthand experience of how things work that a lot of providers, we did not necessarily know. And so I'm excited that she's partnering with me in this webinar. Before we get into the Strategic National Stockpile information and we introduce our colleagues from the SNS, I want to talk to you just very briefly about SMI for those of you who do not know who and what SMI is. So SMI is an organization that is made up of providers, suppliers, distributors, and disruptors. We came together in 2005, and now we're in year 16. There's about 130 total organizations, nonprofit, non-commercial, small working group with a big impact, making a difference. We work on initiatives that we really believe will make a difference in the supply chain. And this NSS initiative has certainly proved to be one of those. And so now as we move on to our next part of our webinar, I'm going to turn it over to Lisa to talk a bit with you about the context for our webinar, how we came together with our SNS colleagues. Lisa?
Thank you so much, Jane. And thank you everyone for joining us today. We are really excited to be here. We're incredibly grateful to the partnership from SNS and FEMA, both John and Brian here to walk us through some really in-depth knowledge sharing for the SMI membership and all of our guests here today. Just to give you a little bit of background, we started an initiative last year, Q3, while in the midst of the heavy pandemic, to really talk about inventory preparedness and coordination. This was an SMI initiative that we were all obviously, and we had started conversations on this, prior to the pandemic, and then this kind of evolved into this initiative. Then we identified with that initiative the critical role that our federal partners were playing in the response for the pandemic, how we partnered together real time with them, and how just education and support and collaboration could really help us as we move forward to ensure that we are better prepared moving forward. So we reached out to SNS, had an introductory call in the last quarter of 2020. And now both SMI and SNS meet quarterly to talk about current issues, initiatives, how we can work better together. So we're super excited to have them with us today. If I could have the next slide, please. So the Collaboration Council that was formed in 2021, it's really a steering committee made up of both SMI and SNS leadership. We meet at least quarterly, and we're really trying to get a dialogue between between the federal partners and the private industry so that we can really share pain points from both sides. We want to ensure that people are educated on what's available and how things are working. And then past that, it's really about how do we work together collaboratively in the future, and how can we be a sounding board for each other so that we can rapidly respond to issues as we face them as a nation. So I am incredibly passionate about this. I think it is amazing what we've been able to accomplish thus far, and the federal partners have been there with us every step of the way. So looking forward to sharing this with everyone today. I think this is a great opportunity just to show how far we've come in this partnership and really talk about things that we can do together in the future to move us forward. So without further ado, I would like to introduce the two gentlemen from SNS who are here today. Brian Hartsfield, Supply Chain Interface Team Lead for the Strategic Logistics Branch, the SNS under Assistant Secretary for Preparedness and Response, which is ASPR, and John Friedenberg, the Deputy Branch Chief for the Strategic Logistics Branch of the Strategic National Stockpile. So thank you, gentlemen, for being here today, and we look forward to hearing this robust presentation.
Great. So good afternoon on the East Coast. Good morning on the West Coast. This is Brian Hartsfield. And as Lisa stated, I'm the lead for the Strategic National Stockpile Supply Chain Interface Team. And before we start, I do want to thank SMI and all of those on the webinar today for your participation. Next slide, please. Looking at the attendance, we have a very broad audience. I think we have something to share for everyone, whether this is your first introduction to the Strategic National Stockpile or you're an enduring partner. So our goal, you're going to understand the request process, the supply chain ecosystem, and finally, a few updates around the SNS expansion and challenges that lay before us. So I will use a few acronyms. As a matter of fact, we've already used SNS and ASPR, but I wanted to get a few of those out of the way for consistency, just so we don't get behind as we move through the presentation. So HHS, of course, is Health and Human Services. ASPR, as was stated, is the Assistant Secretary for Preparedness and Response. That is our new affiliation, so we work for the ASPR now. If you've worked with the stockpile in the past, you may remember that we work for the CDC, CDC being the Center for Disease Control and Prevention. And yes, we were moved from CDC to ASPR. We still work closely hand in hand with CDC. We just can't do a response without them. As a matter of fact, if you send us an email, you'll still see our emails are cdc.gov. So that's how closely we're integrated. Next slide, please. So when we look at the ASPR's mission, it reflects exactly what the SNS does. Since the enactment of the Pandemic All Hazards Preparedness Act, or PAPA, in 2006, the ASPR has served as a lead federal health agency responsible for saving lives and protecting Americans from health security threats. In this lead role, ASPR serves as principal advisor to the Health and Human Services Secretary on matters related to federal public health and medical preparedness and response for public health emergencies. And in addition to important policy-related responsibilities, ASPR coordinates federal public health and medical response to emergent threats and all hazard incidents, advances research and development of medical countermeasures to help respond to these health security threats. And I wanted to call out that the historic mission of the SNS, which is now part of ASPR, is and was to protect the health of the nation. So that broad mandate supports the ASPR's mission in some very unique ways. A couple I'll share with you in this discussion today. Next slide, please. First and foremost, the SNS is the federal repository of emergency medical countermeasures. We were established in 1999 with a $51 million investment in response to Y2K. For those of you that don't remember what Y2K was, that was when the year 2000 hit. We weren't sure the computer systems would actually work. So they established this pharmaceutical stockpile just to have some kind of capability in case everything went down. So I'll take you through this evolution this morning, how we grew from that initial investment to an enterprise now valued at over $12 billion. Inventory is located strategically in non-disclosed locations across the United States. It's managed by third-party logistics providers under contract to the SNS. So I wish I could disclose more, but it's a national security issue. So that's about all we can share on that aspect. We do have 4 deployed chemical antidote caches in over 1,300 locations, such as some of your healthcare systems and local fire stations. And that ensures that over 90% of the US population is within 1 hour of a chemical antidote. The SNS still maintains a 12-hour pushbacks. Those are air transportable broad spectrum support items and medical material. We use that in case we're unsure of the type of incident. So understand that most of it won't be needed, but it's a catch-all to support an overwhelmed local response. And that 12 hours is a little misleading. And the reason it's misleading is that we can send it much faster. The only difference between that and what we call our managed inventory being that large quantity of warehouse material, is that the managed inventory generally goes out to support a known threat, whereas the 12-hour pushback, or should just say the push package, is that sent out for something we just don't understand what's occurring in the local response. Next slide, please. Here's our current organizational chart. Now, it's a little different than some of you may remember, and the difference being we've added an acquisitions branch. So let me just go through this with the responsibilities quickly. At the top, you see our director, Steve Adams, and his deputy, Lisa Dillard. And starting left to right, Dr. Sue Gorman leads our science team. They provide all the subject matter expertise on pharma and medical device use. Jason Steer is our management and business operations branch. This is basically our business and HR team. So they run the operation. Shirley Mabry, she leads our operational logistics, and respectfully, her team is the SNS. So she manages all of the SNS assets, as well as the warehouses and the shipping contracts. Marge Griffin leads our information and planning branch. Think of them as the Emergency Management Operations Center. So they coordinate not only the plans, but the response itself. Ron Autumn, who's my supervisor, is responsible for all external partnership and strategic planning, which includes public-private partnerships, also interfaces with state, local, territorial, and tribal partners. So we're that external facing piece to the stockpile. And then lastly, David Kelly leads the new acquisitions branch. Contracting and acquisition has been a very important role for us in the past. I'm going to mention one or two unique capabilities that it enabled during the Zika response in 2016. And I'll just primer that with who would have thought that tire shredders and fumigation would have been a medical countermeasure, but it was. Next slide, please. So a little more on our product and mission. You can see here, we have 12 billion in holdings, and that's to respond to sea burns of chemical, biological, radiological, or nuclear incidents. And over the years, the mission increased from that to include natural disasters and emerging infectious disease. We will walk through some of those milestones shortly in a way that I hope paints a picture of our evolution. We're going to go through a timeline and hit some of those milestones that have shown that evolution and what we're trying to get to. And likewise, we've taken a more durable medical equipment approach, such as ventilators, in response to needs that have basically occurred throughout the healthcare system driven by COVID. So touches on why I mentioned acquisitions and contracting. It gives us a flexibility for when we have an undetermined requirement for unique situations. Another example during the Zika response, as I said, was the SNS mission to protect the health of the nation. That is a broad mandate. And using that broad mandate, we were able to do things such as fumigation, Zika prevention kits. And those kits were simply trying to eliminate the vector, the mosquitoes, from biting individuals. We had to stop the transmission, right? So who'd have thought that those were medical countermeasures? The only reason we're able to do that, strong contracting, strong acquisitions. So let me leave you with this. If you ever need an assist, tell us the problem. Don't just tell us that I want a certain item. Find creative ways. We can find creative ways that assist you in that response that necessarily aren't just treatment-based. Next slide, please. So all of our efforts are now in support of our commercial supply chain. And I wanted to show you this snapshot of an ecosystem where we all live and work. It looks complicated, and it can be, but I promise I'll simplify the request process and our relationship by the end of this presentation. So let me give you a second to review. I'm sure you can find yourself on this diagram somewhere. Now, one critical point that I want to bring out is that instead of being all things to all people, we've learned that the SNS is better positioned as a buffer to the commercial supply chain, supporting this ecosystem. So our goal is to provide space and time to allow the commercial supply chain to ramp up in order to meet demands placed upon you during the response. I'll give you 1 second just to take a look. Okay, next slide, please. So what exactly is the rationale for stockpiling? You can see on this slide in the bullet points that there are some situations where there's no market to support production of a countermeasure. Think back to that sea burn mission or even smallpox. It's just not something our commercial market supports on a daily basis. So a product is available, but not in sufficient quantities. This actually has become a result of lean manufacturing and our just-in-time inventory practices. Not a lot of buffer in today's supply chain. So imagine a large-scale response to something like anthrax that requires pills to people within 48 hours. Or without that intervention, the mortality rate ramps up quickly to over 90%. And also, some dispensing strategies in today's market aren't optimized to do mass dispensing in a timely manner. So think of that anthrax scenario again. That example just works on a couple of different levels of why stockpiling is important. So once again, knowing the commercial supply chain maintains less than 30 days of supply for PPE and pharmaceuticals, we feel this is the perfect place for the SNS to position itself to support the ecosystem and the commercial supply chain. Next slide, please. So as that buffer, SNS can supplement critical shortages while manufacturers and distributors ramp up. So please do understand, and I go back to why we have acquisitions, that the current formulary holdings do not and cannot possibly cover every threat. We can cover some short-term needs in PPE and pharmaceuticals, as well as provide those one-off requirements such as antitoxins or specialty items that are not readily available. But the commercial supply chain is the system of choice. Healthcare is already integrated, delivery systems in place, and relationships already established. By collaborating, we found that collaboration simplifies responses to the healthcare settings, maybe not mass dispensary requirements that still go through the states, but commercial support, especially primary or pharmacy chains and drugstores, can definitely supplement, if not handle, regional issues. So together, we're more resilient and accept much less risk. Next slide, please. So I've mentioned this slide previously, and I want to highlight some important milestones in our history. It goes back to 1999. I first mentioned that we were the nation's pharmaceutical stockpile in 1999 with that $51 million investment for Y2K. That took us to about 2001. And in 2001, anthrax letters were being mailed to our congressional leadership, and it highlighted the fact there was no real solid CBRN response capability, and Stockpile was given that mission. So that became our primary role until about 2009. And we all know what happened in 2009. H1N1 proved that we did have PPE and other items available from that CBRN mission that could be used to support an infectious disease response. H1N1 also highlighted one of the first uses of antiviral distribution through pharmacy chain drugstores. So that was a great start to an ever-growing relationship. 2014, 2015, another big milestone for us, and I'm sure you all remember when Ebola hit the United States. It was a real test of our capabilities to combat an emerging infectious disease. Healthcare providers and medical distributors may remember we had to prioritize. And at that time, we called it tiering. So if you hear tiering, it's really that prioritization of where PPE should go. The top priorities were given to those Ebola treatment facilities. The second tier, the second priority, of course, were those screening facilities. And finally, everyone else. And that worked well, became a tool in our chest and actually a best practice. We find ourselves in a similar situation again. Tiering greatly reduced some hoarding as well. That was a challenge, and most of it driven out of fear. So very important milestone for us when Ebola hit the United States. Then in 2016, Zika presented a challenge with those affected having children with microcephaly. So our pharmacy partners once again came to assist. We had 120 stores in Puerto Rico that provided information on Zika and also provided Zika prevention kits. Once again, long sleeve shirts, DEET, things to remove that vector from getting bit by more mosquitoes. So that was a huge communication platform and partner during that response. Of course, now, COVID-19, supply chain drugstores have vaccinated almost 50 million residents. Distributors and manufacturers have helped acquire components to support over 1 billion shots. Now, remember that I'm going to have a different number a little bit later on, but we have acquired enough components to give 1 billion vaccinations. That tremendous growth, and I have to say thank you for everyone for all of that support and that ever important collaboration moving forward. Next slide, please. So what is in the SNS? We get this question all of the time. This is what I can share. And I know it's generic, I know it's vague, but this is the one outward facing thing that we share around our formulary. Why? Because it's a national security issue. Countermeasures can be overcome. So that's why we use discretion anytime we share any information. The table reflects the threat, the type of prophylaxis, the type of treatment material in hand. And I at least wanted to share this with you so you could see that we were primarily geared to those category A threats, then eventually infectious disease. So in short, our formulary, category A, CBRN threats, natural disasters, emerging infectious disease. So we're not all things to all people. One very critical item that you need to know, SNS does not determine what is in the formulary. That's a larger group of federal agency executives from departments such as Department of Defense, Veterans Affairs, Food and Drug Administration, Centers for Disease Control, Health and Human Services, and they're also looking at now to revamp it to get more input from our state, local, territorial, and tribal partners. So once again, SNS is just given that requirement based off the national security threat and assessment from those executive leaders, and our job is to then execute that requirement. Next slide, please. So I just wanted to stop right here and hit a few bottom lines. So first of all, SNS has positioned itself as a buffer in support of the commercial supply chain. The commercial supply chain and where those relationships already exist. The systems are integrated. The care system, you all work together perfectly. So we want to take advantage of that. Number two is SNS does not define what is in the formulary. As I just said, those requirements are set for us. Our job is to execute, not to purchase items that go in there. And then three, HHS is increasing the scope and inventory levels within the Strategic National Stockpile to support more all hazards response. So we are growing and evolving. Next slide, please. So let's talk a little bit about distribution. Some of you have experience making resource requests and receiving material from the Strategic National Stockpile. Historically, that looked like a request that came up through the state, went to the federal government, and then distribution back down through the state to point of use. Now, as we've evolved, there are a few more modalities that I wanted to share and review with you. And we'll start with pre-COVID, then we'll go to near term, and finally we'll talk about our current capabilities and modalities. Next slide, please. Okay, this one's the classic model. Remember I mentioned anthrax. This model was put in place to maximize speed of distribution, pills to people. So mass antibiotic distribution through the state to the point of use. You can see some of the benefits and the challenges listed on this model. The real benefit to this was increased speed. It allowed states to manage their own resources. It was good for a prophylaxis campaign. Negatives include limited federal visibility in the local distribution. And being a former local, sometimes maybe that's not so bad from a local perspective, but it also puts a lot of responsibility on the state and local resources, which historically have seen a lot of decreases in funding and staffing over the last decade. Next slide, please. So the near-term model incorporates more collaboration through commercial distribution, leveraging existing relationships and in some instances, ordering system as well as dedicated commercial fleets. So we've come a long way from increasing information sharing and limited distribution partnership during H1N1 and Zika, which you see today in the current COVID-19 response. And by the way, distributors and manufacturers may be on the call. My last update showed we, or I should say you, have made over 467 million COVID vaccinations available across the United States in less than a year. We could not have done that on our own. So once again, thank you for that. Now, this model does support large-scale efforts using familiar relationships. The one negative here is that the state can lose situational awareness. So if we don't include them in all the communications, they then get out of the response. And remember, all responses are local. You fight these diseases in your communities. It's not from a federal building up in DC. Next slide, please. Our current reality, we use multiple modalities all at once. To go back to the chemical antidote kits that are already in our hospitals, you see that in the lower right-hand corner here. We distribute directly to states that request support as part of their response plans, as well as to support the control of their own resources. In some cases, we still do direct shipments, say of antitoxins or one-off specialty items or antidotes to point-of-care facilities and medical distributors. So the whole of community approach does work, especially in a national and I guess I should say in a global level response. Next slide, please. So let's look at how request for resources is made. Now, I want to be clear. I know a lot of you on the call have done this. Some of you have experience in it. Some of you have not. So we're going to go through the request process. Once again, remember, all responses are local. People tend to think it's federal push right down your throat. It's really not. Think of it the other way. It's local, up to federal, and back down again. So reality is that you, at the local level, will see an increase in case counts. You're going to see an increase in hospital visits, reported illness. All that happens locally before those trends are put together, either at the CDC or Health and Human Services. The impacts will hit you first. So in short, requests get elevated from you, say point of care, to the county public health or county emergency management agency, goes to the state, and from the state to the federal government. Next slide, please. And this is what the process looks like with a little more detail behind it. Now you have homework here. You have to. Remember, all responses are local. We need you to know who your contact at the county level is. So who is that local public health or emergency management official that you need to go to elevate your request? Understand every jurisdiction across the United States is different. I can tell you that in the South, things are very county driven. If you get into the Pacific Northwest, it's very home ruled and driven by municipalities. So we need you to go out and find that point of contact that works with your organization. That local point of contact is probably at the county level. They'll elevate to the state, where the state official will work with our regional emergency management coordinators or RECs here at ASPR to send in a resource request form. And that resource request form will be turned into a tasking, which is step 2 on this diagram. We will then set up a coordination call with you, which is steps 3 and 4. And once that information is validated, we will fill the request and material will be en route to you. We do request delivery confirmation to close the order and appreciate the fact that you're probably going to be overwhelmed at the time. That's just how responses are. We know it's extremely demanding on staff and resources, but if you close that loop with us, that really helps drive the process forward. Next slide, please. Now, we do use 2 deployment methods, push and a pull. So I listed a couple examples on the types of responses that determine the method of deployment. Even though I've said all responses are local, for those unique situations where containment and timing is critical, the SNS and the federal government will push material to your affected areas. The standard process is the pull method. Simply put, this is us answering requests made by you through the state when resources are scarce. So push versus pull. Next slide, please. Whether push or pull, we use 2 allocation strategies in the past, and we plan to use these 2 moving forward. So pro rata is simply you receive the same percentage of available material as a percentage of your population base. So to be fair, we do hold a little bit back simply because in some instances we see flare-ups in the second resurgence of a disease or something that we have to address. So we need some sort of reserve to tamp those back down. Tiering, of course, we talked about that a little bit with Ebola. That's that prioritization of limited resources, especially in times of dire need. And once again, the best example is during Ebola, we did not have sufficient amounts of high levels of PPE, everything that met that high droplet protection standard that was required. And then of course, people out of fear were hoarding it to make sure their facility and their employees were protected. We actually worked with the safety equipment manufacturers in the chemical industry, procured non-medical industrial gowns that met the right level of droplet protection, just as a backup. So just a little point of interest in that. Next slide, please. And this takes us to our current initiatives, where we'd like to share more around data utilization, expansion of our mission, and future goals. So our Deputy Branch Chief, John Fredberg, will discuss those efforts, and then I'll be back with you for some final thoughts. John?
Thanks, Brian. Next slide, please. So as Brian walked you through some of the previous slides, he sort of touched on where, the kind of the genesis of the creation of the program, where we've been, the different responses, and some of the ways that we're organized. What I'm going to talk to you a little bit about are some of the things that we either learned or relearned as a result of the current pandemic, or some things that we think are going to be important for us to continue to grow, as Brian mentioned. One of the areas, and it's difficult to explain all the different ways that product comes into the SNS, but generally we receive expert opinions and funding to put material designated for the responses that Brian talked about into our formulary. One of the things that we quickly found during the pandemic is we just didn't have enough on the shelves to act as a buffer. And so in the last year or so, we've made a concerted effort to really beef up the applicable commodities that are associated with the pandemic, and now hold significant quantities across not only PPE, but some of the key pharmaceuticals related to the pandemic. That growth not only dealt specifically with the pandemic, but it was a very rapid kind of infusion of product. And so the amount of new warehousing and staff and systems and stuff to manage that has gone hand in hand with that kind of growth. Brian mentioned one of the areas that we're growing a little bit is our acquisitions and our contracting area. That is not something that we had grown over the course of our development. So we've relied on, one of the areas that we've relied on other federal partners is DoD to provide some of that contracting support, so that we could acquire these large amounts of materials as rapidly as we could. Other federal agencies that have been instrumental to some of the growth Brian already pointed to, but DoD was one that, historically we had not really worked with before. So that's another area that has grown into a very good partnership over the last year or so. Another one that he touched on that we're doing a lot of exploration with to gain best practices and efficiencies in is distribution. The SNS, in addition to having warehouses full of product spread across the United States, has a very robust and capable plan for distributing a wide variety of products. Brian touched on some of the Suburni ones, but we also have a lot of product that's cold chain managed, and a lot of it has special handling instructions that require a variety of modalities to push product to where it's needed in the case of an event. The timeline that he showed you should have also demonstrated that we started in a Suburni kind of a mindset, but we've grown in different streams and different pathways that require different distribution models that as we come across that specific event, sometimes we find that the people who do this day to day and who are experts in it have a better system that what we have and more efficient. And so we're looking for ways to partner where it makes sense, to where we can play off of each other and use our capabilities in a more concerted or maximized way. That is one of the things that we definitely have learned over the course of the pandemic, in that the scale and the duration of this particular response is something that, again, is a new frontier for us. Suburni, as Brian mentioned, is much more controlled, meaning that it was never expected to last, over 18 months or close to 2 years now, which this current pandemic has lasted. And so as we've gone into new frontiers like that, we've had to adapt and change different things. And one of the things, again, we're working on right now is more efficient distribution. One of the projects that I have been working on now for almost 2 years now is something called a supply chain control tower. One of the things that did not really exist at the start of the pandemic was really good, insightful knowledge about a commercial supply chain for a particular commodity. As many people on this webinar know, the complexities of individual supply chains in and of themselves require just a real concerted effort to understand. And when you start adding things like pharmaceuticals and different variables like that, it was something that not only was eye-opening, but something that we found to be a necessity to really operate in this particular environment. And so over about the last 18 months or so, we've grown a capability that I'll explain on a couple of next slides, but it really was an idea to look at an end-to-end supply chain visibility, not really to manipulate it or change it, but to allow the system to provide information so we make better informed decisions about how we deploy our material, and if we can be more efficient in the way that we stockpile. As Brian mentioned, as we've grown, the requirements have grown, but the funding really has not kept pace with that. So we have to be very judicious about what we spend our money on. And one of the things that we really have come out of the pandemic in a much better place with is this idea of data to drive decision making. Next is, as I mentioned a minute ago, the growth that we've experienced. We have had to go back to the drawing board a little bit again, and the Suburni architecture organization that started kind of our journey has had to be adjusted along the way, and we find ourselves once again at a kind of an inflection point where that air quote old model has to be revisited. The complexities of the systems that we're now being brought into and have been created as a result of the pandemic aren't necessarily supported 100% by the way we've always done things. And so we are now looking at ways to grow in a way that it makes sense, but we want to make sure that we're accounting for not only what we're doing today, but what we anticipate our role is going to be in the future. As Brian showed on one of our slides, we're showing roughly about $12 billion in inventory right now. At the start of the pandemic, for reference, we were about 8 billion. So it's not only the expansion of a dollar value, but we now have more warehouses, we have more product, and we have different kinds of product than we had before. And so to support that growth and that delving into new areas, we're now having to look at looking where we put things and how we structure ourselves to be, the best that we possibly can be in this particular role. And then expanding domestic manufacturing is a little bit of an offshoot of the control tower work that we've done. One of the things that, in addition to sort of efficiency with our product and our role in the response, is to try to look at ways to reduce vulnerabilities. And so risk mitigation is an area that we've gotten into more now, where, especially as it relates to some of the products for supporting the pandemic, trying to not be so reliant in an area of either the world or in a manufacturing line, let's say, that if we have a failure in that one area or that one node, that it really causes system problems. And so, as many people know about the pandemic, there's a certain region of the world that produces a lot of the material that is germane to this particular response. That's been a result not only of some of the things that Brian mentioned earlier with the just-in-time system that we all kind of have adopted, but things like reduced cost and reduced areas where emissions and things like that are not nearly as regulated as the United States have forced those systems to different parts of the world. In the United States, there's an interest now to where it makes sense, try to reduce some of that risk and bring some of that either onshore, closer onshore or near shore to the United States. Next slide. I mentioned a project that I've been working on for about 18 months now, and it's called the Supply Chain Control Tower. And this is a mostly supply side system that we have built at Health and Human Services. And we ingest nearly daily transactional level data from distributors, and it captures information about the major PPE categories that again have kind of been germane to this response, but also approximately 40 pharmaceuticals. Most of those relate to intubation for ventilator patients, but we have a tremendous amount of data that we absorb every day. We focused on the middle of this chart when we first started out on the distributors, and I'll show you some numbers here on the next slide. But the idea was to look at the flow of product, and we felt that if we could get enough of the information from a representative number of distributors, that we would have a good picture about where problem areas may crop up, or we could just see the flow of particular commodities. On the far right, points of care, we receive weekly data from hospitals and long-term care facilities, more in the form of survey data. So it's not true data, it's more qualitative, but it provides us a really good understanding about how that level of the system is able to acquire product and maintain it on hand. We found it to be even, again, although not numeric and a weekly cadence, we have found it to be very, very helpful in identifying early some areas where there may be some imbalances in supply and demand. On the far left is manufacturers, and there's a subset to that also, which is supply chain analysis and intelligence. And the manufacturing one has been one area that we've tried to get as much or similar information as we could with the distributors, but are finding that to be a much more difficult landscape to navigate on the data side. As I mentioned, a lot of manufacturing is done overseas, and so having the same visibility that we have in the distributors has required a little bit of a different approach. That has not meant that we've kind of given up or thrown in the towel. It's just that there is a different methodology that we've had to take to gain kind of similar insight into that part of the supply chain. If those of you who remember, though, back February, March of 2020, that part of the supply chain was a hugely important aspect that we really didn't have great visibility on. At the start of the pandemic, it was really more of a supply problem than it was a demand problem. The region overseas that produces a lot of the PPE had shut down factories for a period of about a month. And so that production that we had counted on, or you count on in a just-in-time system, really wasn't something we had great visibility into last year. We have a much better visual of that now, and really have highlighted the importance of that information. The subset that I mentioned is what I would call kind of supply chain intelligence, and that is things that are part of the supply chain that you need to monitor so that you can understand if you're going to have some kind of a system problem. One example of that is that we've been monitoring the ports, especially the West Coast ports, for about the last year. And in doing that, we've been able to kind of watch the ebb and flow of product that comes, again, primarily from Asia into the West Coast port system. And again, I'm sure many of you have much as good or better insight than we do, but at the moment, that is a significant problem in the overall supply chain. So if you understand, let's say, gowns or gloves or that one little commodity supply chain, if you don't have visibility on the port system right now on the West Coast, you're not going to have the picture you need. It is at its heart kind of a flow problem, and right now the pipe is clogged. And so you need to understand and have that visibility in detail, and that's one of the areas that we've gone into as we've kind of grown and developed in the program, and spending a lot more time and energy on this part of our kind of assessment of the overall system. Next slide. These are some of the numbers that I just spoke to a little bit. Again, 8 medical distributors, and we get nearly daily transactional level data. About a month ago, we went over the 1.5 terabyte mark to give you an idea of the volume of information that we get in. And the commodities, or PPE commodities, if you will, are some of the ones that have been really talked about since the beginning of the pandemic: masks, gloves, gowns, N95s, those sorts of things. And so we've now got about 18 months of really solid data that we never had before, that, if we see a spike, we can determine if it's a severe spike or not. As an example, we have that kind of system knowledge now that we didn't have before. I mentioned the pharmaceutical drugs before, mostly related to ventilator patients. 4 point-of-care test kits and monoclonal antibody therapeutics are the two other ones that we ingest. There's a sister system out there that is working with the national vaccine strategy that does similar data collection. Brian highlighted one of the ones that related to the amount of vaccine that's been produced and moved. But they also have a system that they monitor the needles and syringes as it relates to their project. Our interest is to determine if that system has had any impact on kind of the general mainstream. And so our needle and syringe interest is really everything minus what Brian and his group have kind of tracked. And that's to see if for typical procedural things, if needles and syringes are hard to come by as a result of the large orders that were necessitated as the vaccine program grew. Again, grown tremendously in about 18 months or so, and it provides a very good end-to-end picture of the supply chain. Two other areas that I would mention that we had pretty good visibility on before, but it was the connection and the inclusion that has made it more complete, and that is the inventories and the growth in the commodities in the SNS and FEMA. So as the contracts have been awarded and the material has been delivered and the capabilities have been growing, we capture that as part of the overall picture. So we not only have the flow, we have what's on hand and what comes into the SNS and FEMA as a result of the contracts I mentioned on the previous slide. And then one that we, quite frankly, had a real black hole. We had very limited visibility and couldn't really figure out how to do it. But have been using a system that the SNS has had for a while that allowed us to capture some state inventory data. And having that information has been really, really insightful for a lot of different reasons. We found state stockpiles, if you will, are at, or in many cases, much greater than what's being held at the federal government. We've never had that picture before. And so having that, in addition to the other pieces that we have really allowed us to grow a capability that we think is a very good addition that serves a lot of different things. We've used it for industrial base expansion analysis, economics or efficiencies in the SNS, and just handling routine problems as they arise day to day, where someone will introduce some kind of a problem that needs the analysis and data behind it. And now we're able to kind of rapidly formulate a response to those kinds of questions and stuff as they arise. But again, one of the things that we've grown and we think will be an addition that we're going to continue on with. Next slide. So last, I'm going to touch these really quick. Going forward, I highlighted a couple of things that we've done, and some other near-term things are that, and I mentioned in the prep kind of to this call, one of the, the COVID response has been horrible on several levels. That's not debatable, but there's been a couple of positive things that have come out, and one of them is that, it's been a catalyst to break some of the barriers in collaboration to allow us to do things that we have talked about before with industry partners and other parts of government that we really want to maintain that momentum. So the partnerships that we form, not only commercially, but with other parts of the federal government to allow us to build out some of the capabilities, we don't want to go backwards to where we were. We want to continue this kind of collaboration and look for ways to continue to improve on new systems and look to leverage unique bonds or capabilities that we have. I mentioned the control tower. We've oriented a little bit on things like industrial base expansion. And so the goal would be to take that analysis and reorient it a little bit more on the SNS and provide more kind of ROI towards the SNS. Meetings like this and with other trade associations are invaluable to us. We get into areas that you allow us to reach that are otherwise difficult. And so continuing to build on those relationships and foster new ones that we haven't even explored yet is something really at the top of our list for kind of the next wave of where we take the program as we continue to kind of grow it. And last, down at the bottom, I think that one of the things that we have kind of had to look introspectively a little bit about is that we really have to come quicker into the 24th century on technology and innovation and look for industry experts that do this every day for best practices and things that, that we can take a piece or a slice of what you do and apply it to what we do to make ourselves better and improve on the things that we already do well, but leverage the things that we don't with people who it makes sense to utilize their skill set. Next slide. I'm going to turn it over to Brian after I just flip one more slide here. I think that this will be available to you in the slide deck, but two areas quickly. One is, go ahead, next slide. We do have some educational material that's available. It talks a little bit more in depth about some of the programs that Brian and I have talked about that we didn't obviously have time to go into detail on. Produced in a variety of different formats. We do focus on education heavily when we're not, kind of actively engaged in response. And then next slide, leave you with some reference material that are, you're able to kind of click and go online and find out, probably some answers to questions that we won't be able to cover today. With that, I'm going to turn it back over to Brian for the last little bit here, but thank you very much.
So I'll wrap up by saying it's going to take one ecosystem, all of us to work together to make this happen in the future. For us, it's better data integration, it's a better requirement, and really that collaboration through industry partners to make this work for all of us in the future. And with that, that concludes our presentation from the Strategic National Stockpile. And I'll go back to Jane and Lisa. Thank you.
Yeah, thank you, Brian and John. What great sharing. For those of you who are participating with us in this webinar, I think you can appreciate the great relationship we have built with this Strategic National Stockpile team and the amount of information sharing that we have enjoyed. So I just want to reiterate, in case I lose a few folks here before we wrap up, the webinar was recorded. The slides will be out on the SMI website so that you can access them. So know that. And then also we have a survey at the end where we want you to participate in, and feel free to, add questions in that survey, and we will get back with all of you with the answers that we can. And so now in the last couple of minutes, we've got some questions from quite a few of you, and we obviously won't be able to ask them all. But a couple that popped up that I thought were sort of relative to a lot of the things that many of us are dealing with, and that is the large inventory. What I think you said 13 billion. If I have the number in my head, I could be off a little bit, and that's a lot. It is nowhere near much higher than anything we probably all have in our systems, but we're very interested in understanding, what strategies you might have employed to make sure that you can respond to product recalls. You can track, all the expiration dates that are assigned to all of that, or on all of that inventory. The normal rotation that we all have to go through. How are you managing that with so much inventory?
John, I'll start, and if you want to come in after. So as far as the stockpile and its holdings, we have our own logistics management system that tracks our expiry and other items. So it's a pretty robust system. I will say on our pharmaceuticals, our inventory is so vast that sometimes we just can't rotate things out. We do want to try to implement vendor managed inventory when and where we can, but those, the ability for you to rotate stock for us, the quantities are just too large for everything. But in our pharmaceuticals, what we do is what is part of the DoD system, the SLEP program, Shelf Life Extension Program. So we're constantly testing our pharmaceuticals after expiry to see that it is still potent and still available. And I'm glad that we actually got to bring that up, because during a response, you may receive something that we have not relabeled simply because of the cost of relabeling. And it may have an expiration date on it that has passed, but I guarantee you that it has been tested, it's part of the SLEP program, and it is a viable product.
Thanks. Another question that has come up, would there ever be an occasion, and what would be the mechanism whereby we would contact you all directly without necessarily going through the state?
Well, I would say we don't recommend that. If you do manage to get a hold of us individually, we're going to turn around and pull the state right back into the conversation. Remember, all responses are local, and with them not being in the know, we may be missing a larger, or I guess I should turn it over, a regional issue that maybe they are tracking that we are not aware of on the federal level. So 100% of the time, we're going to turn around and include those state partners.
Okay, thanks. Lisa, I'm going to turn it over to you. Oh, excuse me.
I was just going to say, I would add one more thing to what Brian said. If you remember his kind of ecosystem chart, but I mean, the reality is we're probably talking to some of you right now. And so in a variety of different ways and a variety of different mechanisms, we have contacts with most of the people on that chart, and obviously more for doing a lot of the different things that we do.
So I'm going to turn it over to Lisa for the next 5 minutes or so for her questions.
Thank you, Jane. I think we kind of hit on it earlier in the presentation, but I saw a lot of commentary in the chat on, what is the best way to partner with SNS on product replenishment. There was a lot of questions on, U.S. manufacturing. Is that a priority when we're considering items going, being refilled into the SNS? So if you can just speak to, what agency, I guess, is responsible for procuring the product, and then how best to work together.
So the HHS ASPR contracting department or section is responsible for putting out annual solicitations. And that's to help revitalize the stockpile and, for anything that's expired, and we want to bring that up to the correct level. And so as far as the best way to partner, I think it's through association partners such as yourself. What we can do without breaking any contractual, regulatory requirements is we can let SMI and other associations know when a solicitation is hit the street, because we do want people to, compete for that award. And in our minds, that is probably one of the best economies of scale, and one of the best things that you can do to help partner with us is get that information, work through the association.
Awesome. Thank you. Another item that was kind of bantered around a little bit was, the every location or every locale kind of has a different process. So some is at the county level, some is at the municipality level. Do you have any, do we have a chance of getting a more formulated process so that it's handled across the country the same way? Would just like your opinion or thoughts on any ideas on how we can be helpful to, work with our state and local legislative branches to maybe provide a more streamlined experience, especially for those health systems that cross multiple states.
Right.
Trying to understand those points of contact, I'm sure, is difficult. So would love just your personal opinion on, do you think we can get there?
I see John shaking his head over there, but remember, all responses are local. And, the governors have a lot of sway when it comes to this. And one thing, when we talk about, we've heard, say, New York City or others, they've got a requirement of 90 days of supply on hand that they're putting on their healthcare industries or their healthcare providers. You might see 30 days out west in some states. I think the one thing to do is, and it's kind of a groundswell, you need to do it from the local level up. We did it in the state of Washington when I was there, when we, put some processes in place, and we actually got people to change the regulations of the state's law that you are automatically in mutual aid versus opting in, right? So now you had to opt out. I think we need the groundswell through the associations such as yourself, lobby that from that ground level, and we can maybe provide some technical assistance or support in that, but that is really something that will come from you.
Awesome. Thank you so much.
Lisa, and I would just add that they're similar enough. So, they're not diverse enough where we can't just figure out how to work with any group. And I know we're wrapping up. I forgot to say something, if I may, in the beginning. Sorry. Brian and I we represent about 300 employees in the SNS, a variety of different skill sets, and we're very, very happy to represent or be the face of that organization today. So if there's areas that you want to specifically talk about in inventory and all that, we have experts that we can tap into, and we'd encourage that you follow up with us. We have a lot of different diverse group, and so if there's an area specific to the stockpile, I did want to mention though that there's a tremendous staff and workforce that we are just the 2-person face for today.
So we're at the top of the hour. Brian and John, again, thank you so much for sharing today. And I have a feeling we'll have many more conversations before we finish this journey, if we ever will finish it. And Lisa, thank you for partnering with me in this discussion. And to all of those of you who participated in the webinar, please complete the survey that is on your screen, and also include any questions that you might have so we can get back with you. Thank you. Have a great day.